So there are a number of aspects. Obviously, one of the biggest advances in thoracic surgery, pulmonary surgery in particular, is the advent of minimally invasive techniques. So again, in the context of preoperative chemoimmunotherapy, people are worried that a lot of what they've been able to apply in terms of minimal access techniques will come under threat, and that they may have to do operations open. And that may be true for the more complex tumors, but a lot of the times we wouldn't operate on those using minimal access anyways. And in my talk, I show a number of cases where I think vast majority of surgeons would be very uncomfortable to approach the patient, perhaps at all, but certainly by minimally invasive technique, and then you can apply that. So that's, I think, one of the exciting aspects. There's also the notion of maybe being able to offer less extensive operations. So we have two big trials, two of the biggest trials ever done in thoracic surgery, one from the Japanese Cooperative Group and the other from sort of a North American Australian collaboration led by Dr. Al-Torki, comparing lobectomy to either segmentectomy or sublobar resections. And the survivals are equivalent, if not better, with the use of less extensive operations. And so I think there's really a window of opportunity that's being created by the administration of preoperative therapy, where a patient who may have needed an pneumonectomy can be treated with a lobectomy. A patient who might need a complicated bronchovascular sleeve now is treated with a much more simple operation. And perhaps even offering these sublobar resections to patients who have really remarkable responses. I think really the next level question is, are there patients who have complete responses in whom we can predict that has occurred and maybe not operate, because no one really feels better having a chunk of lung removed, and if we can get the same survival outcomes, then why do it? And so I think that's a really compelling, interesting question. It has to be done carefully and looked at carefully, but there is a window, at least for certain patients, to maybe really minimize the burden of the treatment.